I'm Dr Mhoira Leng. I've been involved in palliative care education and advocating for it, but also in delivering it for around 3 decades in 4 continents and 15 countries. I'm joining you from Uganda today, and I have roles currently in education in Makerere University, Islamic University in Gaza, and in Edinburgh University in the UK, and a number of other current involvements. I'm a specialist palliative care physician and global palliative care educator. I want to use this short film to talk about something a little different, and that is how can we use education to be tools for wider advocacy. And I want to give some examples. First of all, make some kind of connection. We've been running education programs, I think of one in India, in Jaipur, where it was an opportunity to invite someone to come to be recognized, to give out prizes, to make a speech. But in that process, the local person said, could you convince him in 1 minute about palliative care? Now you have to make a connection. And that can be through shared experiences, through the credibility of who you are. In this case, it was a cultural one where I was wearing something that was from the local culture, and that provided a starting point. It can be something else that connects, and that person came, and then what he heard made him stay, and that was the change in him for that institution. Talk about the recognition that person can have in their area. For example, a hospital director listening to an education program told me that he realized now his hospital could have a better reputation because of palliative care. Think about how to connect also into the personal life. I remember speaking at a meeting and saying you need to do an excellent service and also look after the First Minister's mother, and lo and behold, actually, the Minister of Health in that state, again in India, had a mother who was unwell, and we were able to help with caring for her, and that made a huge difference. Think about win-win. How can that person be involved in global research? How can the quality of what they're doing actually make an impact that might inform priorities, might make them look very good at a national, international level, might bring them a sense of satisfaction politically and otherwise? Make sure you continue and you follow up. I was in Gaza, and I went over to West Bank to speak to the colleagues there from the Palestinian Health Authority. And I was at a conference. I saw the lead pharmacist. I caught her. I said, do you mind if I come and meet you? We established some relationships around relations she had in Dublin. And then I asked her why, if we could include morphine in the essential medicines list. She listened. She looked to see what I was talking about. I mentioned WHO lists. She immediately looked at that. And we left with me agreeing with her that I could come back and see her. When I returned, she told me that she had done what I asked within 2 days, which I have to say is the fastest anyone has ever done that. And I asked her why. She said, what you said makes sense. I checked and it was true. My people are suffering, so I need to do it now. Just some of the ways in which education can also give you an opportunity for further advocacy. Thank you so much.